my name is Shelby Howard. I'm doing this video for Bio 230. The date is 6/11/2018. I'm doing this video on the axial and appendicular skeleton. First, we're going to start off with the axial skeleton. We're going to do the anterior skull. So first we have the lacrimal, ethmoid, nasal, maxilla, mandible, frontal, zygomatic, sphenoid, the parietal, temporal, occipital. Then we're going to go to the posterior skull. And on the posterior skull we have the mandible. We have the, let's do this side. We have the temporal, parietal, and then we have the occipital. And then now we're going to go back to the lateral skull. We have the ethmoid, lacrimal, nasal, maxilla, mandible. We have the zygomatic, sphenoid, temporal, parietal, occipital. Now we're going to do the inferior skull. We have the the ethmoid, the sphenoid, and then we have the frontal, temporal, parietal, occipital, so now we're going to go to the vertebral column. We have the atlas up top, then we have the the axis. We have the cervical vertebrae, thoracic vertebrae, then we have the lumbar vertebrae, we have the coxal, and then we have the sacrum. We then are going to move on to the thoracic cage. We have the body of the sternum. We have the manubrium of the sternum is up here. We have the true rib cage, like the true ribs, which are right here because they're connected via costal cartilage. We have the false ribs down here. We have the floating ribs. Then we're going to move on to the appendicular skeleton. We're going to start with the pectoral girdle, which is the clavicle and the scapula. We have the upper limb, which is the humerus, the radius, the ulna, and then we have the hand and wrist. So in the hand and wrist, we have the phalanges, and then the metacarpals. We have the trapezium, trapezoid, capitate, hamate. Then we have the scaphoid, lunate, trichotrum, and then the pisiform. We're then going to talk about the pelvic girdle and the lower limbs. So this is the pelvic girdle. We have the ilium, the ischium, and the pubic bone. The lower limb is the femur, patella, tibia, fibula. Then we have the ankle and foot. We have the phalanges and then the metatarsals. We have the medial cubiform, intermediate cubiform, lateral cubiform, and cuboid. And then we have the navicular and talus. And then on the very back right here, we have the calcaneus. Again, my name is Shelby Howard. This video is for Bio 230. The date is 6/11/2018. Thank you for taking the time to watch my video.